Why this tiny germ is a bigger deal than people think. Most people hear the words stomach infection and just think of a rough day, maybe two, and a lot of awkward trips to the bathroom. But Shigella is one of those germs that can punch way above its weight. It is a bacteria that causes an infection called Shigellosis, and around the world it has been a major cause of diarrheal disease. WHO has even described it as the leading bacterial cause of diarrhea deaths. What makes it extra nasty is how little it takes to get sick. We are not talking about some giant invasion here. Research and public health sources say a very small number of Shigella bacteria, sometimes around 10 to 100, can be enough to start trouble. That is part of why it spreads so easily in homes, schools, daycares, and anywhere hygiene slips for even a moment. What Shigella actually is. Let's keep this simple. Shigella is the germ. Shigellosis is the illness it causes. CDC lists 4 species of Shigella, but for most people, the big thing to know is not the Latin names. The big thing is that this bacteria targets the gut, especially the large intestine, and that is why the symptoms can get intense fast. You can think of it like a tiny bully that gets into your digestive system and starts a fight with the lining of your intestines. And your body does not stay quiet about that. It reacts with inflammation, pain, urgency, and diarrhea. Sometimes a lot of it. How people catch it. Here's the part people need to hear clearly. Shigella spreads through what doctors call the fecal-oral route. In normal human language, that means germs from poop somehow make their way into someone's mouth. Not pretty, but that's the truth. That can happen if someone does not wash their hands properly after using the bathroom or changing a diaper, then touches food, a toy, a surface, or another person. It can happen from contaminated food or water. It can spread in childcare settings. It can spread through sexual activity too. CDC also warns not to swallow pool water and says people with Shigella should avoid sex for at least 2 weeks after the diarrhea stops because the infection can still spread. So no, this is not always just, I ate something bad. Sometimes it is dirty hands. Sometimes it is close contact. Sometimes it is one small hygiene mistake that opens the door. What it feels like? Shigella usually starts showing itself 1 to 2 days after contact with the bacteria. The classic symptoms are diarrhea, fever, stomach pain, and cramps. In some people, the diarrhea can be bloody or last more than 3 days. And one of the most annoying symptoms is that constant urge to go to the bathroom even when there's not much left. That is why this does not feel like a random, my stomach is weird today situation. It can feel sharp, draining, and relentless. The body loses fluids, the gut gets inflamed, and the person often feels wiped out. Some people may have mild illness, but others can get hit hard. What it's doing inside the body? This part is actually kind of wild. Shigella is acid-resistant, which means it can survive the trip through the stomach better than many germs. Then it reaches the intestines, especially the colon, where it invades and irritates the lining. That irritation triggers inflammation, and that is what drives the cramps, the urgency, and sometimes the blood or mucus in stool. So when someone with Shigella says, "My stomach is on fire," that is not just dramatic storytelling. Their gut lining is basically in battle mode. Who needs to be extra careful? Anybody can get this, but some groups need to pay extra attention. CDC notes that children younger than 5 are commonly affected, and people with weakened immune systems are more likely to get severely ill. WHO also points out that the burden is especially heavy in young children and in places where sanitation and clean water are harder to maintain. This is also why outbreaks love places where people are in close contact. One child brings it home, hands are not washed well enough, someone shares food, someone else uses the same bathroom, and suddenly the whole house is having the worst week of the month. When it stops being just a bug, here is the line you do not want to ignore. CDC says you should contact a healthcare provider if there is bloody diarrhea, diarrhea lasting more than 3 days, severe stomach cramping or tenderness, fever, or if the person feels very sick. This is even more important for people with weakened immune systems, and while many cases get better, complications are real. Mayo Clinic lists dehydration, seizures, reactive arthritis, toxic megacolon, bloodstream infection, hemolytic uremic syndrome, and rectal prolapse among possible complications. Some of these are rare, but rare does not mean imaginary. How doctors check for it. Doctors usually confirm Shigella with a stool test. CDC says testing can be done with stool culture or newer diagnostic tests, and culture matters because it can also help show which antibiotics, if any, might still work. That matters because drug resistance is becoming a bigger problem. So if someone is really sick, the goal is not to guess, it is to test. What actually helps? The first big thing is hydration. CDC says many people recover without antibiotics in about 5 to 7 days, and mild cases may only need fluids and rest. That sounds simple, but dehydration is one of the main ways diarrhea becomes dangerous, especially in kids and vulnerable people. Antibiotics are sometimes used for severe cases, but not every case needs them, and resistance makes this more complicated than it used to be. CDC has warned about extensively drug-resistant Shigella strains, which means some infections are getting much harder to treat with the usual medicines. And here's a very important "don't do this" moment. CDC says people with Shigella should not use anti-diarrhea medicines that slow the gut down, like loperamide. In other words, this is not the time to tell your intestines to just sit quietly in the corner. How to stop it from spreading? This is one of those times where the boring advice is the gold. Wash hands with soap and water, especially after using the bathroom, after changing diapers, and before eating or preparing food. Do not prepare food for others if you are sick. Avoid swallowing water from pools. Stay out of the pool while sick. CDC also says children should stay out of the water until 2 weeks after diarrhea has completely stopped. And because Shigella can spread through sexual activity, CDC recommends avoiding sex for at least 2 weeks after the diarrhea ends. It may sound strict, but this bug does not care about good intentions. It cares about opportunities, the bigger problem. What makes Shigella worth talking about is not just that it causes miserable diarrhea. It is that it spreads easily, can hit vulnerable people hard. Some strains are getting more resistant to antibiotics, and there is still no widely available licensed vaccine to rely on. So the real lesson here is simple. If someone has fever, bad cramps, or bloody diarrhea, do not brush it off. If you are sick, do not spread it around like an unwanted party favor. And if you are trying to prevent it, the basics still matter more than people think. Soap, water, clean food, clean hands, and some common sense. The simple takeaway. If you remember just a few things from this video, remember these. Shigella is a bacterial gut infection. It spreads very easily. Symptoms can start fast, and bloody diarrhea is a serious sign. Many people recover with fluids and rest, but some cases need medical care. And because treatment is getting trickier with resistance, preventing the spread matters more than ever. Tiny germ, big mess. And now you know exactly why.